Hi, I'm Dr. David Hill, and today we're going to be talking about asthmatic infants. Now, knowing if an infant has asthma can be really difficult because there are lots of things that can make an infant wheeze. For example, some infants wheeze because they have gastroesophageal reflux disease. Many infants wheeze when they get a viral upper respiratory infection, like a cold. Some infants, however, do wheeze as a result of allergic asthma. How do we know which ones those are? It can be a little tricky, but one of the things we look for is a pattern of recurrent wheezing over and over again. If there's a particular exposure, such as to a dog or cat, mold or grass, that seems to reliably cause the wheezing, we might think that's from asthma, which is really an allergic type of disease. Now, if you hear wheezing in your infant, you really want to take that infant to see a doctor pretty quickly. What do we mean by wheeze? Wheezing is a high-pitched sound that a baby makes when he or she is breathing out. It's not a sound that you hear when the baby is breathing in, and it's not a low-pitched gurgly kind of sound like there's fluid in the pipes. That's called rhonchi to a doctor, and that's a pretty normal part of a cold. That doesn't bother me nearly as much as a wheeze. The wheeze, however, is a concerning sound made by air rushing through narrowed airways, thousands of them all at once, almost like a calliope. Now, signs of respiratory distress accompanying wheezing are particularly concerning. So if you see that your baby is breathing too fast, more than 40 times a minute, that's not good. If you see skin pulling underneath the rib cage, between the ribs, or at the base of the throat with every breath, that's a sign of respiratory distress. If your baby's making a little grunting sound, a little with every breath, that's very alarming. And if you see the baby's nose flaring with every breath, that's also alarming. If your baby's not feeding well because he or she can't catch his or her breath, that's bad as well. What do we do? Well, we start with a breathing treatment, usually albuterol, although there's another product called levoalbuterol that works about as well. The breathing treatment may help the symptom of wheezing. What it does not do is fix the underlying illness. Then we usually turn to a systemic corticosteroid like prednisolone to try and turn down the inflammation. Now, we have a pretty low threshold for hospitalizing infants who are wheezing or have asthma because they can get in pretty bad shape pretty fast. So if your baby is wheezing and the doctor wants him or her in the hospital, don't be terribly surprised. That say, milder cases may respond to home bronchodilator therapy in combination usually with some sort of corticosteroid. So, talking about what we do about asthma in infants, I'm Dr. David Hill.